guys, welcome back to my channel, and if you're new, hey, what's up? My name is Tanya, and thank you all so much for joining in and watching this video. This video I'm just going to dedicate to all of my loving fawns. I'm not going to give one certain fawn a shout out because I know all of you have been very patiently waiting for this health update. It has taken me some time to be able to process everything. Even though it seems like everything will be okay and I will be fine, I'm not going to know for sure for the next 7 months. So I've had a lot of really bad migraines. I've been stressing out, and unfortunately it's something that is going to be in the back of my mind for the next 7 months because I have to go for weekly blood testing. So bear with me. This is going to be a little bit all over the place. I love you all so much. I think that you guys know this by now. I really truly consider you guys a family. You guys are family, and I know so many YouTubers feel like they don't owe their YouTube community any explanations, that their personal lives are separate. And I mean, if that's how they want to do it, that's obviously their choosing, but I don't think that that is, to me, the right way to go about it. Obviously some people are a lot more private than others, but I feel like we just all have such a sharing openness to our community, our family, and I always want to give you guys updates on what's going on with me. I want you to be informed. You know, I'm still going to film a video on my arthritis and when I was diagnosed and why I got so out of control, so I can help out other people with arthritis and, you know, early diagnosis, and not letting their general practitioners ignore them, because that's what happened in my case, but that's going to be for another video. So yeah, I told you this is going to be all over the place, and I'm trying really hard to keep it together and not cry too. So this video is really dedicated to all of you guys. I just want to thank you all so much for being so supportive, so loving, so encouraging. I can't tell you how much I appreciate all of you telling me to like just take time for myself, that you'll all still be there for me when I'm able to make videos. I know I keep making videos anyway because you guys keep me inspired and encouraged, and I love doing what I'm doing for you so much. I'm so passionate about makeup. It makes me so happy. I mean, I turn into a little kid when I have like a blingy new highlight or the best new lip gloss that comes in or new glitter. Like, it just, I know I'm such a kid with makeup, and I love doing what I'm doing, and I just love you guys, and the fact that you guys are all so understanding makes me feel like not only the luckiest girl, the luckiest YouTuber, the luckiest woman. You guys are like my best friends, and I just could not ask for anybody to be more understanding, because I legitimately have, and that this is not a blanket statement for friends from back home, because there are some standout best friends from back home, but in general, I have friends who don't even, like, since the beginning, you know, of my diagnosis from my health issues that go back over 10 years, that never understood, you know, why I couldn't make this event or that event, because I was laid up in bed for 5 days vomiting with migraines and completely immobile from my arthritis, where I couldn't even open my jaw, type of a thing. So the fact that you guys have never even met me in person and you care so much, just, it blows me away. I honestly am so lucky to have each and every one of you in my life. And I know you want me to just get on to this update, so I will get on to it. I just want you guys to know that. All right, so you know that I had a double procedure surgery in one surgery, which I'll just give a quick sum up. When I had my miscarriage, they gave me 2 weeks to have my body naturally discharge it from the time that they realized I had a miscarriage. And once the surgery happened, they were able to tell me that I was between 5 to 6 weeks pregnant. And during the 2 weeks that they were hoping my body would naturally discharge the pregnancy, the fetus, the sac, like the whole everything, it didn't. So when I had my follow-up ultrasound, I was telling them how much pain I was in, and that, you know, it had been over 2 weeks since I had miscarried. Like, why is there so much bleeding still? Why I was in pain where I was like curled over in all of these different crazy positions, just trying to find some sort of relief somewhere, somehow. And I couldn't. I would be just bawling in agony because the left side of my stomach, and it would radiate outward. It was just so, I can't even describe it to you. And my lower back pain was so bad. So they did the ultrasound where they go inside, and they said that both of my ovaries were enlarged, but my left one had torsioned, which means that the left ovary had flipped over because it had developed a 5.5 centimeter cyst. And the cyst was bigger than the ovary, so the ovary was flipped and the blood supply was cut off. So they said I needed to have emergency surgery to fix the ovary, get it back to normal, have the cyst removed, and get that blood flow going again. Because if I lost that ovary, most women, it's not a big deal. The other ovary can completely take over and you can carry on as normal. But if something happened and I then lost my other ovary, I would go into menopause. And I'm 31. I turned 31 this year. So they said, and then again, a normal woman could then go on like the premenopausal hormones to stop the menopause from happening, because, you know, you're so young at 31 to have menopause. But because of my rheumatoid arthritis, I'm not a candidate for any of the hormone therapy to stop the menopause from happening. So I would actually go into full-blown menopause at my age. So it was a really big deal to try to save my second ovary. They then also thought that I had a second pregnancy in my fallopian tube on the left tube. So they thought that there was a chance they were going to have to remove the tube and the ovary. They weren't sure until they were going to get in there what the situation was. But the surgeons were able to fix the ovary and remove the sac in one procedure. They didn't know if I was going to have 2 surgeries or if they were going to get it all done in one, and they were able to do it all in one surgery, thank goodness, because I ended up having a really bad reaction to the anesthetic. It had settled all into my left side, like right under my collarbone, this whole area, through my neck, my shoulder, and behind. The pain was so unbearable, like you couldn't even touch my skin. It was so bad. And so when I called the nurse in when I woke up, I was, freaking out a little bit. Like, did something happen? Am I not going to have full movement of the left side of my arm for some reason? So she went and got the doctor, and then the doctor, or the anesthesiologist, and the anesthesiologist said that, I just had a reaction to the anesthetic, and it settled in on my left side of my body for some reason, and it would start to dissipate over several hours, which it did. It took about 24 hours though, and then it was eventually back to normal. So then they removed all of the tissue from the cyst, and they were able to fix my ovary, and there was no pregnancy in my tubes. So my tubes are intact, my ovaries are intact, and they removed the fetus and the sac. So I wasn't at risk for infection anymore, because my Enbrel injections that I take alongside with my methotrexate injections for my rheumatoid arthritis put you at a much higher risk for infection. So that was another concern they had with the fetus being inside of me for that many weeks gone, and the sac being in me, because you can develop a bad infection from that. So they got all of that taken out. Then they sent the tissue off to the pathologist, and the doctor said, in hindsight, he wishes that he would have taken a biopsy while he was in there, but they hadn't suspected at the time that I had a molar pregnancy. So I had another pregnancy happen at the same time. I've never heard of a molar pregnancy. And he hadn't done a biopsy because there was no reason to suspect that I had this molar pregnancy, which I'll tell you, I have the paperwork from the doctor. So the pathologist was able to say that I had a molar pregnancy, but they weren't able to get into any other details. And what happens is that I had a third chromosome. So I had one viable pregnancy, which resulted in a miscarriage, and then this third chromosome developed into this molar pregnancy. All right, so molar pregnancy happens when tissue that normally becomes a fetus instead becomes an abnormal growth in your uterus. And even though it isn't an embryo, the growth triggers symptoms of a pregnancy. So this explains why they couldn't understand after I miscarried why my labs kept coming back showing that I was pregnant. And they were scared to operate. They didn't know what to do. They didn't want to remove the sac. They kept doing more ultrasounds, and it showed that the fetus was definitely gone, but my hormone levels were at like a level 400. I can't remember what that meant, but they were so high that they were at a 400. So, and that ended up being the reason why, was because the molar pregnancy was telling my body that I was still pregnant, and I was still going through pregnancy symptoms all of those weeks after the miscarriage because of this. So they say that a molar pregnancy needs to be treated right away, and all of the tissue has to be removed because it can cause serious problems in women. When you get diagnosed with it early on, the way I did at least, your chances for serious problems dramatically decreases, and my levels have already dropped from 400 to 5. So I'm on the right track. Everything is going down. I have to go for blood work once a week for a month. I've already gone twice. Well, I guess once a week for 5 weeks, technically, because they did it in the hospital. Then I went for 2. Then they want me to go 2 more times. And then it's once a month for 6 more months after that, to keep monitoring my levels to make sure that they get down to a 0. So apparently, oh my gosh, about 1 out of every 1,500 women with early pregnancies can have a molar pregnancy as well. And it's thought to be caused by a problem with the genetic information of an egg or a sperm. It can sometimes happen with twins, where one is an actual fetus and one ends up being a molar pregnancy, but that's rare. And then There are different risks, which I'm not in any of those categories, because it's after the age of 35. It's if you have a history of molar pregnancies, if you have a history of miscarriages, which that was my first one, and if you have a diet low in folic acid, which I have a folic acid prescription to counteract the methotrexate that I take. So I don't have a low diet in folic acid because I have to take folic acid supplement. A molar pregnancy causes the same early symptoms that a normal pregnancy does, like missed periods and morning sicknesses. But a molar pregnancy causes other symptoms too, like a lot of bleeding, which I had, severe nausea and vomiting, which I had, being very nervous, tired, sweating a lot, an uncomfortable feeling in the pelvis, and I had all of that. Most of the symptoms also occur with a normal pregnancy, but like I said, all of that continued after the miscarriage, which is why we weren't understanding what was going on. So then it says, how is it diagnosed? And my doctor diagnosed it. They just gave me a huge printout of like so much information on it. It's unbelievable. I'm just trying to like skim through what's important and what isn't. Some molar pregnancies, even though they remove the growth, some tissue can get left behind and then it can continue to keep growing. But it doesn't appear like mine is that case because my levels have dropped dramatically. So that is really, really good. Now the scary part. The molar pregnancy can turn into cancer, but the good part, I'm getting a headache even talking about it. The good part is that it is in a very, very treatable form of cancer. Like, it pretty much completely treatable as long as it's caught early on, which is my case. So even though it can turn to cancer, since we caught it right away, essentially I would go through treatment, and the treatment is a much less aggressive form than a lot of other cancers. So there's a little bit of chemo involved, a higher dosage of methotrexate, which I'm already taking methotrexate, so it's kind of like I'm actually treating it by treating my arthritis, just a much lower dosage. But methotrexate is what they would have me on, just like I said, in a higher dose, and it can spread through your body, but that's usually when it goes undiagnosed. And a lot of times it goes undiagnosed because of a woman having become pregnant and actually going through the entire pregnancy and then delivering the baby and then having issues after the 9 months, and then they discover it, and then it's too late at that point, and then it's a much more aggressive therapy treatment to cure the cancer at that point, because the molar pregnancy then usually turns into cancer by that point, which is not my case, obviously, because we got it right away because of the miscarriage. So they said that they don't know if I got the molar pregnancy because I became pregnant, or if I got the molar pregnancy first and then I somehow got pregnant, because they can't explain how I got pregnant, period, because I am crazy insane when it comes to taking my birth control, because I legitimately have OCD, and I have this internal clock that goes off every single day when it's time to take my pill. And the pill is supposed to be like 99% effective when you are that adamant about taking it. I have literally never missed a pill. I've never been more than like 30 minutes late on taking a pill. And that was so rare that I was even 30 minutes late. And that was like a traveling situation, caught up in lines at an airport where I just like couldn't get to it type of thing in security. And then I got to it right away. And I've been on it for 15 or 16 years now too. So they said they cannot explain how I got pregnant based on my pill, based on the injections that I take, because I take 3 injections a week, and the amount of pills that I have to take because I suffer from I take pills for the arthritis as well that go hand in hand with the injections. I take preventative medication for migraines. I'm on medication for OCD, and then I have post-traumatic stress disorder. I need a tissue. Sorry, I'll be right back. And that because of the post-traumatic stress disorder from the abusive relationship I was in for 11 years, I developed the OCD from that relationship as a coping mechanism. And then I have anxiety disorder and panic attack disorder. I've been diagnosed with all of them, and I'm on medication, and I've been in therapy and everything for all of it, and severe insomnia. Like, I'm talking, I can go weeks and weeks and weeks without sleeping for a minute, and I can't function, but I will just be awake and not able to sleep. So I'm on a lot of medication to try to help everything that's wrong with me on my insides and my head. So they have no idea how any of these pregnancies occurred. So they said it's treatment right away is to remove all of the growth from the uterus, which if you're also not having kids, then a hysterectomy is a really great option because that will just completely prevent anything. And I cannot have kids because of all the medications I take. Our only possible option for a biological child is surrogacy. But they think that my eggs are essentially poisoned, and my ovaries are so enlarged and pissed off because of the meds that they don't even think surrogacy is an option. But I have 2 stepgirls that are seriously the best stepgirls in the world. Like, I am so lucky because I have heard horror stories, and these 2 girls are just fantastic little girls. So I am so whole and so complete with my stepgirls, my furry babies, Kurt, my family, you guys, my friends. So it's okay. And I've known for 10 years that I can't have biological children, so it's not anything new to me. So if you guys are like, I know it's more of a shock to you, but I've had over 10 years to process this and grow up knowing this because I have had arthritis for over a decade. So it's not new news to me. So yes, I would have, they said for my case, if I didn't have the hysterectomy, because that's a big procedure, that's a big surgery, that's more risks of infection, that's a big scar. But they said that they can do a hysterectomy now by like vacuuming it out. So I don't know, I might go that way if it comes to that. But they said otherwise it would be a combination of chemotherapy and methotrexate. It's just super shitty because I don't know until the 7 months are up whether or not I'm in the clear. They said all they can tell me is that the levels either stay the same or keep dropping, but if I'm not at a 0 at 7 months, I need to start cancer treatment right away. If I'm at 0 at 7 months, I'm totally in the clear. So that's where I'm at. And like I said, I really don't want to worry you guys. I'm almost talking myself up as well, because 7 months is a long time, and I'm only 3 weeks into this monitoring, and it just stays in the back of my head. So that's what's really crappy about this situation. It's just a long waiting game, and that's a constant reminder because I'm always going in for blood, and I like have permanent needle marks on my arms, and they're just like always sore now because I'm like always being poked. And then every month I have to see my rheumatologist for blood work, for making sure my liver's functioning fine because of the injections as well. So I'm constantly having labs done for that as well. So I will definitely keep you guys updated, you know, along the way if there's any other news. But aside from that, it's technically just under 6.5 months away before I can give you guys a complete, yay, I am free, I am in the clear, everything's fine, and I am good to go, and there's no more worrying, and it's all good. So I'm sorry that this was such a delay. It was just, things have been crazy. There have been a lot of doctor appointments, a lot of blood work. I've had to have my other doctor appointments. It's been a lot of processing on both of our ends, you know, with Kurt and with myself, with my own family. I wanted to give them time to be able to process everything too, even though, like I said, I know I'm being so repetitive, but it really, truly should be nothing. Like I said, the levels have dropped so drastically, which is so amazing. So it is seriously the smallest chance of anything. And if it becomes anything, it is like essentially 100% curable. So I don't want you guys worrying. I wanted to just give you guys complete transparency in what's going on and what will be happening over about the next 6.5 months. So that's everything that I can give you guys for an update right now. I wish I had something a little bit more definitive, both to give to you guys and for myself and my family, because like I said, it always stays there. You know, it's a pain in the butt that it's in the back of your mind, but that's just how it goes. So anyway, thank you guys so much for being so understanding and being so patient. I know you guys have all really been waiting this update. It's Luby again. I could never one video without him. Lulu, it's okay, baby. Kurt just came home, so he doesn't know what he's barking at because he's wrapped up under the blankets on his pink fluffy sofa. So anyway, thank you guys again so much for everything that you do, all of your well wishes. Lulu, all of your prayers, keeping me in your thoughts, sending me positive energy, positive vibes, just everything that you do. It means the world to me. So I want you guys to know that, and I will keep you updated if anything changes in the meantime. You know I will. So until the next video, I love you guys so much. Good night, good morning, wherever you are, and I will talk to you guys soon. Bye, guys.